It all started Monday. That's when Premier Scott Moe announced the government would be sending 6 intensive care patients to Ontario hospitals.
This is being done to ensure that they continue to receive the very best possible care available.
But then on Wednesday, Ontario health officials confirmed in an email to CBC News they were prepared to accept up to 12 Saskatchewan patients by week's end. Later that day, at a teleconference with Saskatchewan's Provincial Emergency Operations Centre, the government refused to clarify.
I'm not sure where that number came from. I can't speak to what they say.
Wednesday night, an Ontario physician announced via Twitter that further transfers from Saskatchewan were cancelled. Shortly after, doctors here in Saskatchewan used social media to vent their frustration. Dr. Jeremy Katalka was one of them. He helped prepare 3 of his ICU patients for their journeys to Ontario, and he was mentally preparing for more. But that changed.
To kind of come home, sit down on the couch, open up Twitter and see a tweet from a physician in Ontario that's telling me more information than my own health region is extremely frustrating.
Thursday morning, today, the government released a statement. It called the issue of out-of-province transfers an extremely complicated process and suggested any other sources or unofficial reports about transfers from doctors on social media be ignored. Dr. Katalka says that's a problem.
It implies that those of us that are actually doing the work don't know what the plan is.
This afternoon, in another statement, the province shared 3 more patient transfers are scheduled to happen Friday through Sunday. This information comes on the same day as the number of COVID patients requiring intensive care has dropped from a record 85 on Monday down to 76. Dr. Katalka calls these extra transfers a necessary and correct course of action.
If we don't continue to evacuate patients to Ontario, all of the modeling suggests that our ICU caseloads are not going to decrease and in fact are likely to increase into the winter.
The government has not indicated exactly how many more patients will be transferred out of province as Saskatchewan navigates its 4th wave. It says the decision to move a patient is contingent on several factors and can change with little notice. Jesse Anton, CBC News, Regina.